tonight. So going by your attendance at the WHO's Malaria Ministerial Conference in Yaoundé in Cameroon, with the theme tackling malaria in countries hit by the disease, what is Nigeria's malaria plan?
Yeah, thank you so much. I'm glad you followed that my attendance at the Cameroon Malaria Conference. Let me tell you, today we've had a malaria program in Nigeria since 1948. This is almost 70-something years after. Nigeria has 30% of the world burden of malaria, the highest in the world. It's not acceptable to us as a country. What we've been doing is just maintaining malaria. We have to put a plan together on how we can begin to eliminate malaria. Our foreign partners, our development partners have been quite supportive of us, but we have to take the bull by the horn. This is our country, we're a sovereign nation, we need to make investment. We need to mobilize, we need to do domestic resource mobilization to eliminate malaria. What we have support from our development partners. We thank them for that. We're thankful to that. But then, the way things are being done, buying commodities, mosquito net, that's not a comprehensive part to eliminate malaria. So I went to that conference in Yaoundé, Cameroon. It was a conference put together by World Health Organization for the 11 countries in Africa that have the highest burden of malaria. So we sat down, put plans together on what we need to do to eliminate malaria. The one thing that resonated all through that meeting was countries need to make investment in malaria elimination. We cannot depend on our development partners to eliminate malaria for us. There are several things we're going to be doing, and now we've hired a world-class expert on malaria elimination that will be starting, that we've engaged as special advisor to the federal government of Nigeria, who will lead a malaria elimination program. We need a central coordinator to coordinate what's happening in all our states. We can't say we're beginning to eliminate malaria where in one state in the country we have a malaria prevalence of 2%, and in another state in our country we have a malaria prevalence of 53%, the highest in the world. We're one country, we're one nation. So somebody at the Federal Ministry of Health now needs to start looking at all programs, make sure things are aligned, coordinated. We will invest a lot of our own resources going forward into our malaria elimination program. We will do larval source management beyond mosquito net, beyond indoor residual spray, and we're going to use, there are also a lot of new technology coming up that we will use to help in a part to eliminating malaria. Countries have done it in Africa. Cape Verde just did it. Mauritius has done it as well. And one more country in Africa, they've eliminated malaria in the last few years. You go to our neighboring country, Senegal, their prevalence rate of malaria is less than 1%. Malaria it's a big cause of morbidity in our country. If you look at the morbidity, not looking at the morbidity alone, look at the economic loss from malaria. Look at the human losses from malaria. So we would now move in a path to eliminate malaria, not palliating malaria, not maintaining malaria. We will be working to eliminating malaria in our country.
All right, Honorable Minister. I mean, it's important to say that although a lot of gains have been recorded in HIV advocacy and awareness, there's still a lot more to be done. But also, there are other diseases like hepatitis, tuberculosis, etc. Now, what are your strategy on advocacy and increased prevention?
Good. You know, you look at it, the communicable diseases has taken a lot of has gotten a lot of attention years over year. But now, actually, is the non-communicable diseases that are actually causing more morbidity and more mortality in our country. I'll come to what we're doing about that, but let me address your question about communicable disease. What are we doing with that? Reducing the level of HIV prevalence in our country. You know, the World Health Organization recommendation is 95, 95, 95. We are just about to meet that goal. So we now have a realignment. If you've seen, we now have we're realigning our resources to make sure that we'll continue to do things that will get us to the goal of 95, 95, 95 for HIV. With hepatitis, we're also building hepatitis vaccine into our national vaccination program in the country. I know there has been outbreak of hepatitis in some of our states. Adult vaccination is also being encouraged. But as we now begin to immunize our children from birth, we will have reduction in our chronic level of hepatitis B infection into the future. Also, we're engaging a civil society organization for more education, so that they can continue to educate a citizen on what they need to do. Getting immunization, avoiding situations that can get them infected. So that's what we're doing about that. Going to our non-communicable diseases in the country, it's a burden that it's been rising: cardiovascular diseases, high blood pressure, diabetes, cancer. We are tackling this head-on as well. I told you earlier on, as we started this program, we're thankful to our president for this increase in budgetary allocation to health. We're investing this money into building, improving infrastructures, modernizing our equipment. That will help us to also manage our non-communicable disease. In the area of cancer, you heard the announcement a few weeks ago. The president has graciously approved 6 new cancer centers to be built in each of the 6 geopolitical zones in the country. Also, 12 new diagnostic centers will be built all across our country. Now, we're going to continue to mobilize more resources into our healthcare sector. And then I haven't talked about our sector-wide approach program, where we're now working more with our development partners. Before, things have been quite hyper-fragmented. What we're doing now is that we're coordinating better. We're going to align our resources better now in such a way that our development partners, they will pool with us. Some of them that are not going to pool with us would align where they're spending. Of course, we have a basic healthcare provision fund, which is 1% of the consolidated revenue fund. It's a statutory allocation. Now, 55% of the basic health provision fund goes into our primary health care centers. 45% goes into our national health insurance gateway, and then 5% into the emergency gateway. So what we're doing now, with a sector-wide approach programming, we're aligning resources with our development partners so that more funds can be directed to our primary health care centers. As this fund get directed to our primary health care centers, they'll have more money to hire more frontline workers, improve infrastructures in our primary health care centers, buy more medical consumable, buy more drugs in our primary care centers, so we can begin to deliver better and more comprehensive health care at our primary care level.
All right, Honorable Minister, I'm also very concerned about Lassa fever, because as of February 11, 2024, that's just last month, the Nigeria Center for Disease Control and Prevention said no fewer than 2,122 suspected cases, 411 were confirmed, and 72 deaths. This confirmed cases were recorded from 21 states and 78 local government areas in the country.
Yeah, it's a bit unfortunate. You know, it might be climate change and health. The pattern of Lassa fever is changed in the last several years in our country. Previously, we had the Lassa fever belt, but now it looks as if several areas that are out of our traditional Lassa fever belt are now seeing cases of Lassa fever. You know, Lassa fever is a zoonotic infection. Now, what we're doing, we're supporting our state very quickly in a robust manner. We're providing PPs for them. We're providing medication rebuffering for them to support, and we're also assisting them with early diagnosis. I was just talking to the director of the NCDC, Nigeria Center for Disease Control, yesterday. How we can also improve our public health emergency operation centers, where we can get our Lassa fever cases more reported in a quicker, and where we can now begin to have validated information of positive Lassa fever cases. But at the ministry, we're providing all support that our states need to Lassa fever. But beyond that, it comes back to what I told you earlier. It's what do we do? These are things that will happen, but how do we solve this problem into the future? We're talking about now using mRNA technology for vaccine manufacturing. One of our high points, one of our main focus is to see to engage in research on how we can develop mRNA vaccine for Lassa fever. So we're working. That's a long-term solution, but with the immediate solution, we have a high number of Lassa fever in the country today. But as a government, from the Ministry of Health, we're giving our state all the support that they need at this time.
All right, quickly before we go, let's talk about recreational centers. This has gradually disappeared from our communities. Exercise, mini sport complex were very prominent back then. Any plans in place to restore this culture across the country?
Yes. You spoke about recreational centers, right?
Absolutely.
That was your question. Yeah, okay, good. Of course, preventive is always better than actually treating. So that's why we will be engaging on educating our citizens on preventive measures. Exercise is an important part. As we are today, we don't have that many recreational center gyms across that people can go and beyond the public park. But then, as we move along building our healthcare system, that's going to be part of what we do. In other areas, you have health insurance plan, paying for gym membership. We don't have that here, but those are some of the considerations that we're going to put on the table as once we get to overhauling our national health insurance program, where we can actually encourage the HMOs, even our National Health Insurance Authority, to provide support, to provide some form of support for gym membership. But I would encourage our citizens to engage in as much exercise, brisk walking, jogging. Those are anything that increase your cardiovascular activity would help reduce your incidence of diabetes, incidence of high blood pressure, cardiovascular, incidence of high cholesterol, incidence of cardiovascular related disorders. So I'm using this platform to encourage Nigerians to do more exercise. Even if you don't go to the gym, just brisk walking, jogging on your street would suffice.
Honorable Minister, thank you so much for joining us tonight, and we hope to have more updates from time to time so Nigerians can continue to know what the federal government is doing to keep us healthy. Thank you so much for joining us. I've been speaking with Dr. Lassa, the Minister of State for Health and Social Welfare, tonight to discuss President Tinubu's healthcare agenda. Thank you so much for joining us, sir.
Thank you so much, Jumoke. It's a pleasure to be here with you.
Thank you very much for watching. That marks the end of today's episode of Politics Tonight. But the conversation continues from here. Get in touch with us on X at TVC News NG and at Olajumoke using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News Nigeria. I am Olajumoke Olatunji. Good night, everyone.